Healthcare needs of the transgender community are often ignored or overlooked. Not so at the Desert AIDS Project. Their belief in acceptance, compassion, and empowerment has resulted in a transgender health program which offers health care, job placement, and much more. We're joined today by client Kim Skeete and Desert AIDS Project clinician Anthony Velasco. Welcome, you two. Thanks for coming on today's show.
Thank you for having us.
We appreciate it anytime Desert AIDS Project can come on and talk about what's going on. So, Anthony, first off, tell us a little bit about your background and what you do at Desert AIDS Project.
Yeah, so I'm actually a nurse practitioner. I'm also a credentialed HIV specialist. I'm a WPATH trained clinician, as well as a high-resolution endoscopist. I started my career in San Diego and recently moved to Palm Springs 2 years ago, where I'm currently the co-chair of our transgender health program.
That's awesome. What do you like best about working at DAP?
What's not to like at Desert AIDS Project, right? What's great about Desert AIDS Project is we create gender-affirming environments where we can provide safe environments for our gender-diverse clients. If you're a client at DAP, we provide excellent services, not only gender-affirming primary and preventative care, we also offer behavioral health, dentistry, as well as wellness needs such as acupuncture, acupressure, Reiki, so many other things as well.
Basically everything, is that what you're saying?
Absolutely. We approach it in a very holistic manner.
That's awesome. Kim, tell us about your previous medical provider and how you came to find the transgender health program at DAP.
Well, I went to my previous provider and I told him that I wanted to be a woman, and he prescribed me antidepressants, which I found was odd because I wasn't depressed.
Right.
You know, we go to those providers expecting to seek help and not just have our problems masked. I mean, I'm not a science project, you know?
Right, exactly. So you and Anthony have a saying that helps you stay focused on your journey. Can you share what that is?
Yes, Anthony often tells me I am like the captain of my medical journey and he's like my co-captain, which ultimately means, you know, whatever route we decide to take with my transition or my health, it's ultimately up to me. You know, and I'm grateful for that because Anthony has shown me empathy I've never received from any of my previous providers, and as a trans woman, you're just grateful for that.
Yeah, absolutely. So now that you've been with Anthony for more than 6 months, is that correct?
That is correct.
How have things changed for you?
Well, I'm finally on hormone therapy. We have discussed top and bottom surgery routes and how we're going to go about that. And I just feel whole.
Mm-hmm. Yeah. Talk a little bit about the compassionate nature of DAP and what you find there.
I feel like it's a place where I could just be myself. I'm getting the appropriate health care and there's no stress or stigmatisms with it. It's just you get help and you're ultimately happier, as I am, and I'm, again, grateful.
Yeah, that's awesome to hear. Well, we're going to take a quick break. When we come back, we'll find out what specifically the Desert AIDS Project offers the Coachella Valley's transgender community, so stay with us. We're back with guest Kim Skeete, a client of the Transgender Health Program at the Desert AIDS Project, and her clinician, Anthony Velasco. Thanks for staying with us, you guys. So in the last segment, we got to talk about Kim's journey, your journey. And Anthony, what are some of the unique needs that the transgender clients need providers to focus on?
I think it's very essential that we create partnerships with our clients, and it has to be a collaborative care. We also need to understand that when somebody transitions, it's not only them that transitions, it's also the people surrounding them. It's their family, their loved ones, their friends, their partners. And that's what's great about Desert AIDS Project, is that we not only provide services that are gender affirming for our clients, we also provide support services for their loved ones.
Yeah, absolutely. And what is WPATH training, and why is it so important for clinicians to get that training?
So WPATH is the World Professional Association for Transgender Health. They're the premier organization that puts together standards of care, as well as provide high-quality training, not only for clinicians, but also to different members of the interdisciplinary team. And when somebody is WPATH trained, a patient, a client, is assured that that clinician is knowledgeable in trans health options that are available for that particular client.
What are some of the other services that you offer to transgender clients that might surprise our viewers out there?
So I mentioned about the array of services that we provide at DAP earlier. Like I said, not only do we provide gender-affirming primary and preventative care, we offer behavioral health care, dentistry is one of them. We also offer care coordination through our case management department for people who need assistance in regards to food, housing, and transportation. We provide those services as well. And what's really cool about Desert AIDS Project is we also provide wellness services like acupuncture, acupressure, Reiki, support groups, social and support groups as well.
Right, you mentioned that before. And what about job placement?
Yeah, so in regards to job placements, we have a work re-entry specialist who's working within the organization, as well as having partnerships with other organizations where they'll be able to provide training for individuals who are in the process of looking for jobs.
Okay. And what would you say to any transgender potential patients out there? What would you say to them about approaching DAP and how to go about it?
Desert AIDS Project is a place where we create environment where people can feel safe, they can feel respected and treated with dignity. And I think we have excellent clinicians and excellent staff that are able to provide them the care that they need, compassionate and comprehensive care, so that way they can live their most authentic selves.
Yeah. And Kim, what would you say to people out there about coming to DAP for transgender healthcare?
I would say do it, come aboard. It's the most rewarding I've ever, most rewarding process I've ever felt or had to deal with. It's like family, almost in a sense, and you don't get that other places.
Yeah.
Trust me, I know.
Well, that's awesome to hear. Well, the Desert AIDS Project is located in Palm Springs. For more information on the Transgender Health Program, give them a call or log on to their website at desertaidsproject.org. Many thanks to Kim and Anthony for appearing on today's show. And that wraps up this edition of our show. On behalf of all of us here at Desert Living, thank you for watching.
Thank you.